is there a role? So I would like to know whoever asked this most recent question, is there a role for autologous transplant versus allogeneic? Do we know what disease, whoever asked this question, are we talking about myeloma, lymphoma, multiple myeloma? Okay, I'll let either of anyone who wants to talk about this. Is there a role, what's the difference between auto and allo in myeloma?
I can actually take a stab at it, and then we can also hear what Dr. Rajeeve has to say. But so, in terms of transplant for multiple myeloma, autologous transplants are like the poster child of multiple myeloma. So they have been, shown to have really great outcomes in this patient population. And really, I've only seen one patient with multiple myeloma, and that patient had plasma cell leukemia, for which allogeneic transplant was recommended. Otherwise, for patients with multiple myeloma, sometimes they can develop secondary malignancies and secondary leukemias, in which case also they might be taken in for an allogeneic transplant, but there should be no role of allogeneic transplant for multiple myeloma going forward. And I was recently listening to another talk from some experts talking about the new treatment guidelines for plasma cell leukemia, which being a very rare disease, is unfortunately not very easy to study, and the treatment, is very different, especially after the newer agents came in for myeloma. So they are now recommending, even for plasma cell leukemia, to not go ahead with allogeneic transplants.
I completely agree. I think, there has been a lot of historical data looking at allogeneic transplants in terms of efficacy, but there were recently a lot of studies that showed that the unacceptable limits of toxicity, and the toxicity cannot be, in any way explain away these benefits which are being afforded by treatments not so intense as allogeneic transplant. So in modern multiple myeloma treatment, except if they have like an MDS or an evolving chip or other secondary cancers that may evolve from completely changing the stem cell population, we typically never do.
Yeah, as someone who I treat all the blood cancers and do allo transplant. We largely don't do allogeneic transplant anymore in myeloma based off our newer and safer therapies. I will say there are very rare scenarios where I'll still entertain it, particularly in a very young patient with very, very aggressive disease. Like a 30 to 40-year-old with what we would call high risk features with ugly genetic mutations, and even then it's still, I try to funnel towards good clinical studies with some of our newer stuff, but that would be the one scenario where I would still consider allogeneic transplant in this disease.